As part of NHS continuing healthcare, clinical commissioning groups have a legal duty to offer personal health budgets to those who are eligible. These budgets allow people to receive care and support that best suits them. Previously, the NHS would decide what form of care and support a person received and when they'd receive it. However, with personal health budgets, the recipient or their representative can decide what outcomes they want to achieve and how their budget will be used to meet these outcomes with the agreement of their NHS team. That means people have more choice, control and flexibility over their care and support. So how does this work in practice? Let's say Jill has just been found eligible for NHS continuing healthcare. There are 6 steps you'll need to take. 1. Firstly, you have a duty to tell Jill about personal health budgets and provide information to help her decide whether such a budget is right for her. 2. If it is, you should work with Jill or her representative to assess what her health and well-being needs are. 3. Based on these needs, you should calculate how much money Jill would require for her ongoing care and support. 4. Together with Jill, make a care plan, detailing what's important for her health and well-being and how the money will be used. 5. You should arrange with Jill how to put her plan into practice, making sure that everything is in place to meet her needs. This might involve direct payments to Jill or paying a third-party budget to an independent organisation who'll manage the money on Jill's behalf. If the NHS manages Jill's budget for her, that's called a notional budget. 6. Lastly, you should check in regularly with Jill to make sure everything's going well and adjust her plan or budget where needed. There are different ways to approach each of these steps, so it's a good idea to talk to people like Jill when figuring out the best approach for them and your CCG. This process should fit in with your existing case management for NHS continuing healthcare and provide new options for people whose preferences might not be fully met through traditional arrangements. It might be challenging for you to find a balance between giving people more choice and flexibility and maintaining clinical accountability. It might also be challenging to ensure that your decisions about personal health budgets are both fair to everyone receiving NHS services and sustainable for the NHS. So to manage these challenges, your CCG should form a group of people for you to work with from different areas of your organisation and possibly your local authority and recipients of NHS services. This group will help make sure there's clinical and financial governance at all stages. It's worth noting that you're not using new money for personal health budgets. You're using money that's already available for care and support, but in a different way. Personal health budgets might be relatively new, but the evidence is that they help people have a better experience of care and support and improve their quality of life. To find out more, visit england.nhs.uk/personal health budgets.